For the next type of frame which we use in managing fractures, we'll get to talk about what is known as the Cotrel's frame. Cotrel's frame. Alright, so for the Cotrel's frame, you could see, alright, and definitely you get to see that this type of frame will be applied if the patient has had a lot of trauma. So you want to keep the patient in a position that the bones are not really shaky and all of that, so that they can recover well. So what is a Cotrel's frame? It just refers to a specialized orthopedic device. It's used in elongation derotation flexion casting technique. Okay, just keeping the patient, right? So it was developed by a French orthopedic surgeon known as the Yves Cotrel and also Jacques Morel. Okay, but it was kind of like a Yves Cotrel project. That's why it's actually named after him, you know. So it's primarily used in non-surgical management of early-onset scoliosis in children. So a child is having some 1 or 2 back issues. Alright, so you can see that there's a big band at the back. Yes, so it's the band that you want to actually use and correct that abnormal curvature in the back. Okay, so it's used for what? Early onset scoliosis in children. So this setup allows for what? Application of custom made thoracolumbar cast that it will gradually correct what? Issues at your back. You can see that for this child too, there's something tied here. Alright, so this thing is actually correcting an abnormal, you know, bending of the back, okay, or you could say curvature of the back. So clinical uses, target group is usually used in children that have, you know, scoliosis from infants. Okay, goal is to delay or avoid surgeries. Okay, so you just want to, you know, use manual methods to kind of like correct it. Okay, so process serial casting sessions performed using Cotrel's frame to what? Incrementally correct the curve. Okay, so this method can modulate spinal growth and in some cases even prevent it entirely. All right, so advantages is it is non-invasive, it's not a surgery yet. All right, so it preserves thoracic growth and lung development, allows for 3-dimensional correction of what? Complex curves. Okay, so that's just what, if you ever heard them talking about a Cotrel's frame, okay, it's a rare setup though. All right, but just so you know that something like this could exist in other places in the world.